topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Texas. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. Hey, you know what? The enrollment period for Medicare just ended, but there is so much more to know about. And by your letters, and because of the show, people want to make sure that they get enrolled for next year. So we have got the top Medicare agent, I believe, in Texas. Let me welcome you to Jill Belvin. Good morning, Jill.
Good morning, Steve. How are you?
I'm good. You just got through with the busiest time of your, I guess it's a 3-month enrollment just ended.
You could say that.
But there's so much more though. But how did it go though? How did people feel about new benefits or losing benefits?
It went pretty well. I was able to review probably 95% of my existing clients reached out to schedule appointments to review. So we were able to review their plans and guide them on, whether they should stay or look at new benefits and new plans. A lot of new customers came on board. There were some disruptions in the market. Some, larger carriers did pull out in some areas. They pulled plans and discontinued plans. So that was a huge opportunity to help people, navigate that and revise their plan and get a new one. So it was a great period. Very, very busy. I'm still very, very busy. I think I'm going to do about 12 enrollments this week, but those are people turning 65. So, or, just now going on Medicare from employer group plans. So still busy, but it was good.
Jill, I got to tell you, most of the questions we promoted the show for the last couple of days. Most of the questions now are people are nervous that are getting ready to turn 65, that want to make sure that they don't miss it. What do we tell those people?
Prepare ahead of time. Start researching at least 4 to 6 months before your 65th birthday or before you intend to start Medicare off of an employer group plan. Don't wait until the last minute, and definitely don't wait until you're turning 65 to do it. Medicare will tell you maybe 3 months ahead. I recommend 4 to 5 months ahead to start looking at everything. Start making sure your ducks are in a row, that you have your traditional Medicare in place so that you can review supplemental plans to help offset the cost that you could incur with just traditional Medicare. So prepare and plan ahead. That's my best advice. And speak with an expert as well.
Yes. Well, I was going to say, Jill, I got to tell you, what you do for your clients is amazing. And I say that because it's almost like putting a puzzle together. You've got, everybody's different. Their needs or wants are all different. And you've got to bring that all together and not only show them one plan, but several plans. And you do so much of the legwork for people they don't even realize.
Yes, it is a process. It is a process of, asking questions, determining what is most important to the client. Do they need dental, vision, hearing benefits? Is it important? Is it important for them to keep their current doctors in network? Because that is extremely important to some people. They don't want to lose their doctors. And if that is the case, we must make sure that if they choose a Medicare Advantage plan, which does require that you stay in a network of providers, that your current doctors are in that network of providers. But yes, it's legwork, and it's, making sure that I understand what the client needs and wants. Also, their health issues they're facing is an important part of determining which plan would be best for them. So many, many factors go into that decision.
So a lot of people also want to know about this advantage.
Mhm.
A lot of people who don't understand it.
Right.
Can you just explain that to them? Because that's
The Medicare
where it works, right?
The Medicare Advantage plan Part C is offered by, independent companies, and it is a plan that is basically, sponsored by the government or subsidized by the government. It takes the place of traditional Medicare if you opt into Medicare Advantage. So it does replace your traditional Part A hospital and Part B doctor coverage. But the Medicare Advantage plan then covers that for you. It just takes over. There are definitely differences between traditional and Medicare Advantage. You do have to stay in a network of providers in a Medicare Advantage plan. You have to make sure that your providers are in the network. You also must pay attention to co-payments, because Medicare Advantage does have co-pays that you'll incur for specialty doctor visits, ambulance, emergency room, urgent care, surgeries, Part B drugs, which are things that are usually done by infusion at a center. Like a example of that would be a chemo treatment or osteoarthritis infusions. The other thing that it has copays for is hospital admittance. So you have to pay attention to all of those things, but it does include extra things. The Medicare Advantage, it's a kind of an all-inclusive plan. So they throw in things like dental, vision, sometimes over-the-counter benefits, which provide you with not necessities, just things you might need as far as medical supplies, cough syrup, over-the-counter, not prescription drugs. But they throw those things into the plan. Your prescription plan is also included in a Medicare Advantage plan. So it's kind of an all-in-one type of plan with extra benefits. Even fitness is included sometimes in those. So
yes, that's what I have that. They give me a whopping $35 a month for over the counter.
Right. I have a
what
client.
do you want me to do with this?
I have one client who says he uses that to buy his Sonicare toothbrush every quarter. I said, whatever you need.
Exactly.
Works for that. Yeah.
So, Jill, let's talk about coverage and plan confirmation. So people want to know, when did the new plan their plan actually start?
So if you signed up for new coverage during annual enrollment period, the plan starts January the 1st of 2026. You'll want to make sure that you are staying in touch with whomever signed you up, or they're staying in touch with you to confirm that you receive your new plan details, your new member ID cards for your plan prior to January 1st, 2026. You'll also want to confirm that, you have reviewed the new summary of benefits for your new plan, or that whomever helped you, get the new plan has reviewed that with you, so that you understand your, especially on a Medicare Advantage plan, so that you understand your co-payments and co-insurances and maximum out-of-pocket annually for the plan. and other benefits that they might have put into the plan for dental, vision, hearing, over-the-counter, fitness benefits, things like that, and your prescription drug copays as well. So,
Jill, I got an email yesterday. Again, we started promoting your show two
mhm,
days out, and it was something I never thought about.
right.
This is a gentleman whose mother and father are getting ready to become Medicare eligible. He
Mhm,
said they never read their mail, and he said they have a hard time comprehending. He
mhm,
said, I think there's a lot of people out there like me who want
mhm,
to make sure they understand for their parents. I thought that
mhm,
was a good letter, and I
mhm,
appreciate your show like this. So
mhm,
it's like you never think about, hey,
mhm.
there's kids out there. I mean, there's adult kids
Absolutely. And
listening to a show like this.
yeah, and absolutely. And whenever I have a situation like that where there is a child, not a child, but an adult child,
Yeah,
excuse me, involved, and they're wanting to, understand more about their parents' needs, I will get a appointment with all of them, and including their child, and we will discuss everything so that their children do know what's going on, especially if the parents are having a difficult time comprehending things. Now, if there's no power of attorney for the adult child, they
mhm,
cannot really do an application for their parents, but they can help them understand what's going on and assist them in getting the application done for themselves. They just can't do it for them
right.
unless there is a power of attorney involved. But for those, children out there, or adult children whose parents are struggling with memory issues, with comprehension, they may consider getting a power of attorney so that they can assist and actually handle some of these things for their parents. That's
That's a
something that
great
would be
idea.
beneficial.
What about when should they receive their new ID cards?
Well, you really should make sure that you receive it prior to January the 1st, 2026. If you do not receive it prior to that date, you need to reach out and contact the person who assisted you with your new plan. Um, and sometimes, even if you stay on your current plan, your current company will send you new member ID cards for the upcoming year. So be aware of that as well. Be looking for that, and maybe contact your existing plan if you did not make a change and just ask them, am I getting new ID cards? And if so, when did you send that? Because if they do send you a new ID card, you will have to update that at your doctor and pharmacy for 2026, even if you stayed on your current plan.
There's, I don't know if people quite understand. I was a little confused at first too. The monthly payment, the
Mhm,
premium,
mhm,
uh, my my company sends it to my Social Security. I
mhm.
never see it.
Correct. That is your monthly payment for Part B, which, by the way, is increasing in 2026 to $202.90 per month, from 185 in 2025. So you can expect a little bit of increase. Hopefully, you'll get a raise in Social Security to offset that, um,
Yes.
as well. But if you do take Social Security, most uh, folks who do will have that just directly taken out of their Social Security check. Okay. If you do not take Social Security, that will be billed to you quarterly. So it will be billed every 3 months, and you will be required to pay 3 months at a time. There is a way to avoid that. You can go to Medicare.gov, and you can actually set up an account and ask for an auto debit monthly for that Part B premium so that
Mm.
you don't have to pay quarterly, 3 months at a time. And Medicare can help you set that up. You can call Medicare anytime. They're open 24 hours a day, 7 days a week at 1-800-MEDICARE. So they can assist you with, setting up an account so that you don't have to do a quarterly billing if you don't have Social Security right now.
What happens if, I've heard, and you said it on the show before, there's companies that are pulling out of counties, even states. They supposedly mail out something to you, but I find that a lot of the older demographics think it's just an advertisement and they toss it. They don't all read it. So how do these people find out? I mean, some of these people think that it's just going to automatically renew with the company they're with. How do you handle that?
Well, what I do with my existing clients is I get a list of those who are not going to be renewing, and I reach out and contact them up front. For those who don't have an agent reaching out to them and misunderstand and don't understand that their plan is not continuing, you do still have a special enrollment period to, get a new plan. So for instance, even now, if anyone contacted me and said, my plan is leaving and I didn't realize and I missed annual enrollment, they would have a special enrollment due to their plan leaving their area in order to, enroll into a new plan. There are many special enrollment periods, just to be clear. There is a special enrollment period if you missed annual enrollment due to a FEMA disaster that was declared. There is a special enrollment period for that. So, and if you move to a new location, if you've moved to a new address, you have a special enrollment period there as well. If you have a chronic condition, there's a special enrollment period for, newly developed chronic conditions. If you have a change in your Medicaid status, there is a special enrollment for that. Either you get Medicaid or you lose Medicaid, you have special enrollment for that. So there are many special enrollment periods that fall outside that normal, annual enrollment period guideline. And you also, and I think I've mentioned this on the show previously, starting January the 1st for Medicare Advantage clients who are on Medicare Advantage plans, there is a open enrollment period, and it goes from January the 1st through March the 31st, allowing them to readjust their plans. It could be someone who missed annual enrollment, or it could be someone who made a mistake during annual enrollment and had gotten a plan that they're not satisfied with. They can readjust that plan during the open enrollment period, January 1st through March the 31st of each year.
Okay, so Jill, I'm going to surprise you now.
Okay.
I didn't want to tell you this before the show, because we do shows all over the country.
Right.
With Medicare, you handle the Texas area, and I got so many people complaining about the national commercials, and when they call the company, it wasn't anywhere. People were really disgusted, and so what I did was I called a couple insurance companies and numbers that were advertised, but I didn't just call them once. I called them 3 or 4 times, and I'm telling you, Jill, I got different answers almost every time from the same company. What I'm trying to say is it is so important for you to get a good agent.
Right.
Let them go to, they know what works and what doesn't. And I hats off to you, Jill, because what you do is such a service for people, elderly people are going into Medicare. And I hate to say this, but don't call those national numbers. not when you have someone like Jill that can do the work for
Yeah,
you.
and I don't know why you would get the different answers from those numbers unless it's maybe a call center situation.
Probably was.
There's a lot of people there that, in a call center, what you get is you get hundreds of people answering the phone. Most of them are not licensed and fully certified. So they really don't know the answers. Now, sometimes when you call those numbers, they may transfer you to a licensed agent, but again, you just don't know what you're getting. It could be an agent who's been licensed for 5 months or, just newly licensed, or it could be someone experienced, but you just want to make sure that whomever you're speaking with, does know Medicare. And no one has all the answers. Don't get me wrong. I mean, there are questions that come up that I don't know the answer to, but I am honest. If I do not know the answer, I will let my client know, and I will get the answers to those questions. So, I mean, it happens. I mean, I had it happen this week. I had a client who we had, we're signing her up for a plan, and there were a couple of questions that we didn't know the answers to. So I called the carrier that she's interested in, and we got clarification on everything. So.
Wow. Jill, God, your show goes by so fast. Jill will be back again with us next month. And Jill, tell people who are listening on radio or listening on Spotify how they can reach you.
You can reach me by email, jilllovesmedicare@gmail.com. Also, the office phone number, which is 832-281-4474, or my website, www.insurewithbelvin.com is a great way to reach out to me. So,
Jill, you're the best. We're so lucky to have you. Have a wonderful holiday, a happy new year, and we'll see you next month.
Yes, happy holidays to all.
Thanks, Jill. It's Jill Belvin of the Belvin Agency. We're going to go to break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk 4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.